Yeah, so thanks for having me. My name is Luuk Bouwens. I'm a PhD candidate at Amsterdam UMC, and I work at TNO as well. And today I'm going to have a talk about my research project, my PhD project, which is called Vital at Work, which is about the prevention of stress. And in my abstract, I mentioned the possibility of presenting some results already. I started in January, and I have to disappoint you right away. I don't have any results yet. But no worries, it will be a fun presentation, fun 50 minutes. I will have a nice interaction with you, so don't worry. And to start with, I think you all know something about stress. So I'm a little bit curious whether you think of what do you think that the main cause of stress is? And I want to give you three options, and you can only choose one. So the first option is someone's private life. So his or her financial situation, friends, family, relationships. So that's option one. Option two, work and his or her work conditions. Or option three, someone's personality. So like resilience, coping mechanisms. So three options: private life, work, or personality. So can you raise your hand if you think someone's private life is the main cause of stress? One in the back, a little bit of, yeah. A few. Okay, option two, work. A little bit more, yeah, I think the most. And last, someone's personality. Also a few, yeah. I see someone doubting. Yeah, I will come back to it later, but it's like a trick question. Um, So I will tell you something about my design, but first I want to talk about my background of the project. So um, it's about stress and the prevention of stress, and I really like to go to work most of the days at least, and I hope you do too as well. But that's definitely not the case for all people. So psychological complaints and stress complaints are a big problem amongst workers. So to illustrate, in 2020 there was research that showed that the proportion of workers that faced work-related risks for their mental health was 45% at the EU level. So that's quite a large group. So in an ideal situation, you want to have like organizations that have measures to prevent from this risk, right? But that's definitely not always the case. And that can be have different reasons. So for example, organizations don't know about the existence of interventions, or maybe they think they don't fit within the context of an intervention, of the organization. So that's exactly what we're trying to solve in our project, to use a tailored program, an intervention program, to prevent for stress amongst workers. And to give you somewhat more information, so my project is part of a larger study, which also consists of the work package 2, which is about the reintegration and treatment of workers on sick leave due to mental health complaints. So if I do my work very good, this project won't exist. Probably that will not be the case. But let's go back to my project. So it's about the prevention of work stress. And it will be a randomized controlled trial. So we work together with 5 organizations. They will participate in our study. And every organization will have an intervention group, at least one intervention group, and at least one control group. And this randomization will be done at department or team level. So within an organization, you have like one team that will be the intervention group, and another team will be the control group, and those will be separated from each other. So they won't work together on a daily basis, and they don't talk that much to each other. So there won't be a spillover effect. So a randomized controlled trial. And in this trial, we make use of the participatory approach. And this approach encourages all roles within an organization to think about interventions that could work. So yeah, it's like a structured method with 6 steps, starting with creating the right preconditions, and then look at the analysis of bottlenecks, think about solutions for these bottlenecks, and then a plan of action that you want to implement in step 5. And in step 6, you will evaluate the interventions and adjust where necessary. And during this process, we will try to measure an effect or whether there will be changes. And that we will do at the baseline, so at the start, after 6 months, when some of the interventions are implemented, and after 12 months, so that probably then all interventions are implemented within the organization. And we will measure within the intervention and control group to compare those. As I mentioned, there will be 5 organizations that will participate in this study, and these organizations really differ from each other. So we have like an organization within the aviation, cleaning, industry, and healthcare. And we did this on purpose because we want to know whether this approach will work in different contexts. So the type of work really differs within these companies. The type of workers differ. So we want to investigate whether this participatory approach will work within different organizations with different workers. So if you look into the organization that participate, how does that participatory approach look like? Every intervention group will have like a smaller group, which is called the working group. And that working group will work through all the 6 steps I just mentioned of the participatory approach. So this smaller group will think about what are the bottlenecks for stress, what may be solutions, and they will make a plan of action. And this group consists of all layers within that department. So it will be employees, managers, an occupational health and safety coordinator, HR, communication. So all layers within the organization are involved, and they will think about a plan of action. And from that point, the plan of action will be implemented in the whole intervention group. So only the working group will make a plan of action, and that plan of action will be implemented within the whole intervention group. And the control group doesn't receive anything of this participatory approach, so like care as usual, so to say. So, and now, we want to measure whether that will result in any changes. And to map the mechanism, we assume that, how our intervention will work. We made a logic model of change, but before I will go into that, I want to ask you a question again, because I'm curious about your stress experience. So if you think about the last year, during the last year, who of you had a little bit of stress? Can you raise your hand if you experienced a little bit of stress? Most of you? Like a moderate level of stress? And even a high level of stress? I have a little bit high level stress levels at the moment because I'm standing here. So, but yeah, I think we can conclude that every one of you has experienced stress at some point. And my next question is, do you think stress is harmful for your health? Do you think it's harmful for your health? Raise your hand. Most of you. The bad news is that it is harmful for your health, but that especially holds for people who think it's harmful for your health. So let's think about it. So everyone experiences stress, but that's maybe difficult to change, but you can change the way you think about stress. And I want to mention this because it's really important to measure how people think about stress. So let's go back to my model of change. At the input side, you see our intervention, the participatory approach. Now, that will result in intervention activities, and there are the mental models, so the perceptions of people and his or her attitude towards stress. So we want to know how they think about stress. And also we want to know whether they feel ready to change. So if they are open to the intervention, open to change the way they work. So the intervention activities will, we assume, improve the psychosocial work environment. So therefore we want to measure all psychosocial work-related risk factors, as well as the psychosocial safety climate. So that's about whether people feel free to talk about their feelings, mental health, and whether management thinks it's a priority. So we think the psychosocial work environment will improve, and that will result in reduced stress levels. So that's our main outcome. That is what we're trying to prevent. And we choose to look at the broader concept of stress, not only work stress, because, the question I asked you at the beginning, it was like, maybe it's private life, maybe it's work. So it's like a combination. So we won't want to focus only on work stress, but we focus like on a broader concept like stress. But as well, we would like to include something work-related because the intervention is in the workplace, right? So that's quite important to measure as well. So therefore, we decided that we wanted to know something about the workability, so like functioning, and you can imagine that stress will have an influence on your workability. So that is our secondary main outcome. And maybe you think sick leave, you can measure that as well, but we think that the period of our intervention is not long enough to see an effect on that, and most people are healthy when the study starts, so maybe they don't have any complaints, and then it's maybe difficult to see an effect on the sick leave outcome. So, and I forgot, at the bottom you see like a small, I don't know whether you can see it, yeah, it's like the level of participation, the level of implementation, that's like more a process evaluation, so we will do that as well. And I don't talk about it right now, but that will also be part of the study. And I think that's it. I don't know whether there's time about to share your thoughts, or maybe you have any questions, but thank you.
Thank you, Luuk, very much for your presentation.